Bismillahirrahmanirrahim. This is an ECG of a 16 years old boy who presented with frequent episodes of dizziness along with palpitations. So this is a very interesting ECG actually. Uh, we try to elaborate its findings, and as always we start with the calculation of heart rate, which is reaching up to 280 beats per minute, and there is a left axis deviation. And one point to note that there is a broad QRS complex, and the width of the QRS complex is almost 120 milliseconds or somewhat more in some complexes, and just less than 120 milliseconds in some complexes, but overall it's a wide complex tachycardia. Now the next question is it regular or irregular? So the QRS complexes are not regular, it's irregularly irregular if we look at these complexes. So up till now we have concluded that it's a wide complex tachycardia with a rate of almost 280 beats per minute, and the rhythm is irregularly irregular. Now just focus on lead 1 and we can clearly appreciate delta waves in this lead, and similarly we can appreciate delta waves in other leads as well, but for the time being just focus on the complexes in lead 1. So irregular wide complex tachycardia with the presence of delta waves. So this is an ECG of Wolff-Parkinson-White syndrome with atrial fibrillation. So on the baseline there is pre-excitation, the delta waves, the hallmark of Wolff-Parkinson-White syndrome, and the features of WPW syndrome are a short PR interval and delta wave. And additionally, if we look at V1, it's an RBB pattern. The V1 QRS complexes are upwards, so it signifies a left-sided pathway. If the complexes were downward in V1, it would have been a right-sided pathway. So what happens in WPW syndrome, that there is an accessory pathway that connects atria to the ventricles in addition to AV node. So heart has two pathways for the conduction of the impulses, and eventually they can precipitate into such kind of arrhythmias. They can precipitate into atrial fibrillation, SVT, or any kind of arrhythmia. So in this regard, one thing is very important, that if the WPW pattern is not associated with any kind of arrhythmia, or the arrhythmia is never documented, so we cannot label it as a syndrome. It will only be called as a WPW pattern rather than WPW syndrome. WPW syndrome will only be labeled if it's associated with any kind of arrhythmia. So thank you very much.